right, stocks selling off here as the cases of coronavirus climb around the globe. Airlines, cruise operators, casino operators, retailers, all lower today. Some of the lowlights here, Wynn Resorts, that stock down nearly 8%. Of course, Wynn operates a large casino in Macau. United Airlines shares lower. Starbucks has closed a number of locations in China. Royal Caribbean, Estee Lauder also lower on fears regarding the spread of the coronavirus, its impact across the consumer economy. Of course, a number of images over the weekend of empty malls in China. This, of course, coming during the New Year's celebration. So certainly a lot of anxiety among investors today over exactly where this all goes from here.
And we're certainly seeing that play out in the markets right now. The Wuhan coronavirus is spreading, causing Chinese officials to pull out the 2003 SARS playbook. While the number of reported cases is on the rise, our next guest says there are simple measures you can take to help protect yourself. And joining us now is epidemic expert, Pulitzer Prize-winning science writer, author of The Coming Plague and other books, Laurie Garrett. Before we get into some of the things people can actually do, which I found interesting, I want to start from 30,000 feet here with everything that we know about this. Today, lots of concerns in the market about what's happening and what it means for global growth. Do you think that we have a lot more of this to run, or have we kind of seen the worst? Is this under control?
I think we're at the beginning. The State Department issued a travel advisory today. Americans should not go to China. Now, I can't recall the last time the State Department issued a travel advisory for the entire nation of China. What we haven't seen, good news, we haven't seen a lot of secondary transmission outside of China, except in Hong Kong. We haven't seen, we have 5 cases in the United States that we know of, but they've not given it to someone else. So it's so far relatively controlled. But what's going on in China is out of control. And more than 100 million people are on lockdowns of one kind or another at this moment. All the major cities that are major trading cities and so on are either on lockdown or on partial, schools canceled, public events canceled, all that. And we now know from the Ministry of Health that they were missing cases because, unlike SARS, which only is contagious when you have a fever, this one seems to be contagious when you don't even know you have been infected. And the incubation time is much longer. SARS, most people incubated 3 to 5 days. This is going out 10 days. So that means that potentially individuals are contagious to others for 10 days without knowing it, traveling about, doing whatever they do with their daily life and infecting so many other people. Whatever numbers you're officially hearing from the Central Party Committee or the Ministry of Health are, by everybody's reckoning, including the Chinese government, grossly underestimating the true infection tolls, because they have a lag time in testing people, they don't have enough test kits, they have lines around the block in Wuhan of people trying to get tested, and it's wholly backed up.
So I guess in terms of a timeline here, if the incubation period is several weeks and
10 days,
or 10 days, and we're at the beginning of that, it would seem that there's at least that amount of time before we could get a sense of where the virus or how far it's spreading. But to your last point, it's almost like, will we ever know the full extent of how many people have contracted coronavirus other than imputing, well, if they've locked down this many people and they've shut down this many airports, we could make our best guesses at it? I mean, do you feel like we're ever going to really have a handle on how widely this is spread?
Well, we're going to know because we're going to start seeing cases all over the place. And it's interesting, Canada, which of course went through SARS, had a really tough time in Toronto dealing with SARS in 2003, has issued a huge list of protective measures that they're calling upon hospitals, physicians, and individuals to take across Canada. We have no such recommendations issued by our government. We don't even have somebody centrally in charge in our government to handle this because Trump fired the whole pandemic response team 2 years ago. So we don't actually we're behind the curve. For example, the CDC, our Centers for Disease Control, is currently saying a 72-hour incubation time, quarantine time upon arrival from China is adequate if you have a fever. But the UK has made it 2 weeks. France has made it 2 weeks. Almost everywhere in the world, they're going for the outer end of this incubation time and saying you have to be in quarantine for that long.
So what can you do? You have an article out, and people are buying all these masks. But you're into gloves, not masks, fair to say?
Well, what I want people to understand is that, okay, put your fear in a little box over here and just get realistic. There are two types of classes of viruses that cause common colds. One is the rhinoviruses, the other is the coronaviruses. Mm-hmm. This is a coronavirus. So one of the smart ways to approach thinking about how do you protect yourself is to ask, well, when somebody here in the office has a common cold and is sneezing all over the place, how do you make yourself not get the cold? What measures do you take?
Avoid them.
Well, avoid them. That's called social distancing. And that's step number one. Keep your distance from other people. If they're coughing, ask them to please cover their mouth when they cough. For yourself, think of your hands as your number one problem. Anything you touch that's a common surface, such as if I were to grab his computer, whatever was on your hands is right here, right? And if I were to mistakenly drink from your cup, well, we all know, we've been told since we were children, don't share your utensils, don't share your cups. But I think as here in New York City, we think about the subways, we think about how we move around in the city. The answer, if you're nervous, is wear gloves. And then take your gloves and wash them at night. When you wash your hands thoroughly between visits, if it's socially required to shake hands, wash your hands afterwards.
And then the State Department issued the directive, but certainly Heidi's vacation to Thailand.
I wanted to take this time to ask a personal question. I was planning a trip to Thailand, and I was supposed to fly through Wuhan. Obviously, those flights have been canceled, and I was going to redirect the flight and take a different airline. At this point, do you think it's better that I just cancel the trip altogether and avoid the risk that lies there?
Well, in 20 seconds before the bell.
Right now in Thailand, we I think only have 2 or 3 cases, so I don't think there's a big risk going to Thailand, but I wouldn't route through China.
Okay.
Lori Garrett, it's fantastic to talk to you. I loved your book, The Coming Plague. Pulitzer Prize-winning science writer. You can go and Google her and get all the tips. But gloves, and then you have to wash them.
No masks.
There you go.
Wash your hands.
Wash your hands.
And don't scratch your face. Don't. If you do this, remember, you just put whatever was on your hand on your nose.
All right.
Number of my habits. All right.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.